determining the signs, which has implication for determining of the cause, nature, and location of the illness and patient's physical condition and their treatment. Pediatry of TCM is the branch of traditional Chinese medicine to deal with the pediatric disease according to the theories of Chinese medicine. Theoretical knowledge and application of classic of Chinese medicine. Here, I would like to explain to everyone. You know, the Chinese medicine theory is coming from the theoretical knowledge we call the classic Chinese medicine. There are major 4 classic Chinese medicine. They are guide until right now. They guide us for the treatment, for the diagnosis. So as advanced a part of the theoretical knowledge, we include in this competency. Traditional Chinese diagnostic. The branch of the traditional Chinese medicine dealing with the procedures and practice of examining patient, determining disease and differentiating syndromes, identifying patterns of signs and symptoms of disease, also called the traditional Chinese medicine diagnostic. Okay, here, the traditional Chinese medicine is the coherent and independent system of thought and practice rooted in the philosophy, logic, sensibility, and habit of the Chinese people. It is a result of continuous process of critical thinking as well as extensive clinical observation and testing, which involves herbal medicine, acupuncture, moxibustion, or tuina as major treatment methods. Traditional Chinese tuina, the branch of traditional Chinese medicine concerned with the principles of clinical use of tuina therapy. Traditional medicine include all of the traditional medicine modality and cultural history. There are new terms here is the worm disease. I would like to emphasize here, the worm disease is the branch of traditional Chinese medicine dealing with the study of pathogenesis, diagnosis, treatment, and prevention of worm pathogen disease, also known as the worm pathogen disease. Also known as the worm pathogen disease. Okay, going back to the COVID-19. The COVID-19 right now in China, we have delivered the seventh edition of the protocol for the COVID-19. Part of the major part include the Chinese medicine as the protocol for the COVID-19 treatment. And this is the formula of Chinese medicine. The major is coming from the worm disease. Because the worm disease in China, they consider the epidemic disease there. They're coming from the several hundred years ago, Chinese medicine is start to against the similar any the new disease we consider the worm disease like the COVID-19, like the SARS. They are based on the Chinese medicine theory. They consider it is the coming from the worm pathogen or the moist thumb pathogen. Okay, from the book. So we include this one. The objectives of this competency standard define the minimum required knowledge, skills, and proficiency for TCM practitioners. The competency also defines the proper roles and orientation needed for practice relevant and appropriate to the Philippine setting. National certificates are issued by Philippine Institute and Traditional Alternative Healthcare when the prescribed units of competency have been achieved. This competency standard is herein formulated and developed for the following objective: to upgrade the level of professional education and training of traditional Chinese medicine, with the goal of high quality patient care, setting and maintaining standards of competence and integrity and providing quality life-enhancing services and products to serve as the basis in the establishment of competency assessment and certification system, which can be used for setting up a classified, qualified pool of TCM practitioners, primarily to serve the Filipinos and secondarily to meet the standards overseas. To serve as guide basis for the Professional Regulation Commission and Practitioner and Philippine Society of Certified TCM Practitioner and Acupuncturists in the accreditation of the practice of TCM. To serve as the basis for Philippine Health Insurance Corporation's futures guidelines for reimbursement of practitioners and patients' TCM services. To serve as guide and basis for the development of training programs in traditional Chinese medicine for other professional health workers. To support Philippine Institute for Traditional and Alternative Healthcare goal in formulating policies, standards, guidelines, and practice towards improving the quality and delivery of health services through the comprehensive, preventive, curative, rehabilitative, and promotive development of traditional, complementary, and alternative medicine, and its eventual integration into the national healthcare delivery system. To contribute to bringing about the paradigm change towards value formation, ethical and social transformation, using the holistic philosophy of traditional, complementary, and alternative system of medicine through integrated the multidisciplinary and developmental approaches in accordance to the training of Pitahc, to comply with the policies, standards, and guidelines set by Pitahc. So based on these objectives, that we are going to set what is our entry requirement. As the Chinese medicine, right now, in the former of the China, they have at least 5 years curriculum to be a Chinese medicine doctor. So we try to consider the reality in the Philippines. We make the two options. One is from the school, the regular TCM school, 5 years, or to meet the certain hours of the training, which is the necessary unit of competency. So will be considered. Okay, from entry requirement here, the certified TCM practitioner must be a licensed TCM practitioner, or you get a license from China, from other country as the TCM practitioner or TCM doctor, or we call it CMD, with the good moral character. A graduate of no less than 5 years TCM, or with 550 hours of fundamental theories and knowledge of TCM, 680 hours of clinical subject and skills of TCM, and at least 960 hours of internship in accredited TCM clinic in the Philippines to be completed in 3 years, covering the following categories of the summary: to generally master basics knowledge of TCM, to understand classics of Chinese medicine and main academic thoughts of different schools, to fully understand the properties and action, function, indication, application, combination, usage, and dosage, adverse reaction, and drug interactions of 140 common Chinese materia medica, to master the composition, usage, function, indication, significance, and characteristics of combination, essentials of application, and precautions of 80 common formulas. Understand the composition, usage, function, indication, and characteristic of combination of another 40 common formulas. Point 5, to acquire basic knowledge on human anatomy and physiology. Point 6, to acquire knowledge on basic skills of emergency and first aid using TCM. So this is include using TCM, for example, the herbal medicine action, acupuncture, emergency, or the TWINA. Okay. 7, to acquire basic knowledge on acupuncture, meridian, and collateral acupoints, needling techniques, and moxibustion. To master the meridian, tropism, and location of 130 common acupoints, indications, and needling techniques and these acupoints. To generally master the cause and mechanism of common disease in clinical Chinese medicine. So here's not less than 80 disease. This is the 80 disease, the common disease, and being able to conduct safe and effective prevention and treatment of disease by TCM. 10.10, to acquire basic knowledge on TWINA, its indication and contraindications, actions, and therapeutic principles, adjunctive methods, and the prevention and first aid for TWINA accident. To generally master the manipulation essentials of basic manipulation techniques and the application on human body of various categories, including saying, friction, vibration, pressurization, wrapping, to master the manipulation essentials, clinical application, and precautions in category. 1.3, a graduate of TCM with recommendable conduct and behavior, good values, and ethical behavior to colleagues, patients, and to the community. Point 4, if the requirements for the second point, 1.2, are not met, the TCM practitioner or Chinese medicine doctor must take a refresher course and the final exam before proceeding to the entry requirements for the numbers of patient visits. There is the minimum requirement of at least 120 cases of TCM in internal disease, including the gynecology and pediatrics, and 60 cases of acupuncture, moxibustion, and TWINA. So here is meaning those is acupuncturist, because Chinese medicine include the 3 major parts. One is the Chinese internal medicine. Second is acupuncture and TWINA, right? And then the moxibustion. So if who has get the acupuncturist certification, this is the relate to acupuncture cases, everything can be considered for the Chinese medicine. The 5th point, to those who have acquired Chinese medicine knowledge and training handed down from the generation to generation, or trained by a master and or self-study, and has practiced as a Chinese medicine practitioner with at least 12 years of clinical practice, witnessed by patient and or the community with the reputable character. Okay, so this means even you are not, because the medicine, Chinese medicine, is still a part of the experience. So who has the very good experience, complete of knowledge, even previous, you are not able to enroll any TCM course, you're still able to have the patient by the basic entry requirement. Here we would like to, second point, we would like to emphasize the limitations. In the context of this competency standard, TCM practitioners or Chinese medicine doctors practice is limited to the field of TCM, the TCM only. The following competencies, however, are included and will need other additional qualification and certification. Conducting clinical and or experimental TCM, acupuncture-related research activities. TCM practitioners, Chinese medicine doctors, should not perform any Western medicine-related practices, such as but no limit to prescribing Western medicine, surgical procedures, unless also a duly licensed Western physician specialized in such field. So generally, physicians should not perform appendectomy also. Okay. From certification, the three certifications are defined in this standard. First, the certified Chinese medicine doctor, or we call the TCM practitioners, or certified Chinese medicine dispenser. Why we put this is certified Chinese medicine dispenser? Because since right now, all of the pharmacy costs in the Philippines, they still don't have any complete cost for the Chinese medicine. So we try to provide the training and give the competency standard for Chinese medicine preparation, dispenser, and certified TCM clinic. The units of competency standard for TCM practitioners. We set up the 10 units of competency are included in this standard. As everybody understood, the Chinese medicine, they are the holistic approach. So they are not like the Western medicine have the specialized in the some field. They are more in the general. So the Chinese medicine, they have a three part of the internal medicine. First is the general internal medicine, and then the gynecologist and pediatrics, and another is the pediatrics. So this is the form of the Chinese medicine, the clinical skills, and include acupuncture, include the tuina, acupuncture, moxibustion, tuina. So 5 major of the clinical skill is the form, the qualified traditional Chinese medicine practitioners. So we include the 5 clinical skills in the standard. And you want to be the practitioner, what is the basic or fundamental of the knowledge you need to have it? There are 4 of the basic units here. So 4 of the basic unit plus the 5 of the clinical units, so it's the 9, and add 1 of the theoretical knowledge of classic Chinese medicine. So total are the 10 units. So from this, the 10 units, the first part is basic theories and knowledge of TCM. Even you are the acupuncturist of Chinese medicine practitioner, you will know the hears what is going to discuss the unique competency. This unit of competence standard, the format we follow the Pitahc X16 of acupuncture and moxibustion competency standard. So every unit include the 2 columns here, namely unit descriptor and elements. Chinese medicine a little bit different from the Western medicine, because they are more emphasize the contents what you have studied. So what is the unit contents there? We discussed several times. What is the more important? So this the standard should be in the future for the training curriculum, for the first of the, even in the higher education commission later, could be considered as the guideline. And if you follow the standard, it means you have qualified as the practitioner. So there are the every unit include the 1 of unit descriptor and elements. The first is the basic series of TCM. We attach the Chinese pinyin here. So if in the future there's any reference from the WHO or other school, they include it, we can refer. First, for the basic series of TCM, the unit descriptor to fully understand the basic theories and knowledge that includes the concept of horizon and treatment based on syndrome differentiation. To master all elements are below. So this is elements. So in the future, if the we have in the Pitahc, we have the exam or national exam or everything should coming from this the elements. So this the guideline should be complete. So the elements, the first is basic characteristic of Chinese medicine, definition and contents of yin-yang 5 elements, physiological function and main pathological manifestation of Zhang organs and their relationship. Understand the relationship between Zhang organs and its constituent outward manifestation, emotions, orifice, and thick liquid. Definition, constitution, basic function of meridian and collateral. Distribution rules, exterior-interior relationship, and concrete courses and distribution of 12 meridian, the main function of 8 extra meridian. The definition, generation, circulation, and main physiological functions of essence, qi, blood, and body fluids. The relationships of qi, blood, and body fluid. The definition of constitution and main patterns and concrete characteristics of normal constitution. Point 7, the definition of pathogenic characteristic of 6 excess, pestilent qi, and 7 emotions. The definition of pathogenic characteristics of phlegm and fluid retentions, blood stasis, and internal fire pathogen. Basic pathogenic principles, the basic mechanism of exuberance and declines of healthy qi and pathogenic qi, disharmony of yin-yang, disharmony of Zhang function, and disorder of qi, blood, and body fluids. Point 9, basic principle for disease prevention and definition and clinical application rules of treating disease to pursue the root and emergency of branch and root. Routine treatment and treatment contrary to the routine, reinforcing healthy qi and expelling the evil, regulating the balance of yin-yang, the proper treatment of disease according to the types of constitution. Analyzing, judging, and resolving the clinical problems with the basic theories and knowledge of Chinese medicine. The only you finish the theories of traditional Chinese medicine, you're able to enter the next step of the diagnostic of TCM. The unit descriptor to master the basic knowledge about the examination and diagnosis of disease of Chinese medicine, applying the skills of 4 diagnostic methods by syndrome differentiation for common clinical disease. The elements here, there are first point is understand the meaning of diagnostic method. The main contains basic mechanism and principle of diagnostic method of Chinese medicine. Typical manifestation and clinical significance of presence of vitality, lack of vitality, loss of vitality, or forced vitality, and mental disorder. The difference between normal complexion and morbid complexion. The typical manifestation and clinical diagnostic significance of 5 color, macular, and papular. Cellulitis, flanker and sore, the color, nature, clinical significance of abnormal excrements, to be familiar with is the basic contents and clinical significance of inspection of normal physical and posture. Tongue inspection. Maybe the time is the limit. I give all of you to the major topic. So later, actually, this is all of the detail. The tongue inspection, we include the normal and pathological tongue manifestation, the characteristics and clinical significance of light, red tongues, pale tongues. So they include a different kind of the tongues or common tongue color you need to know. And coating, tongue and coating. This is the point for general rules, characteristic, and clinical significance of the pathological sounds, the delirious speech, unconscious murmuring, soliloquy, money raving. So those is all of the sounds included, even the symptoms between the breathing, shortness, wheezing. Point 5, master inquiry methods. Okay, so we indicate the details of the inquiries methods, and then the normal, and then abnormal. What is the between? Just give the term. The point 6 is the past diagnosis. The past diagnosis include all of the major 26 kinds of the parts, but of course, we indicate is the past diagnosis. It should be referred to the internship 960 hours. And contents and significance of palpation of abdomen. So this is similar with Western medicine, but still a little bit different. This is the palpation of abdomen. They will include the what is the content and clinical significance of palpation of the chest, stomach, skin, muscle. The point 8, essence of Chinese medicine syndrome differentiation. The basic mechanism and principles of Chinese medicine syndrome differentiation. Point 9, for the 8 principle syndrome differentiation. The 8 principle syndrome differentiation is like the yin and yang, exterior, interiors, and then the cold and heat, and excess and deficiency. These all are 8. For the point 10, the common pattern types including yin-yang syndrome, Shibra syndromes, and body fluid syndromes. So include the pathological chains. These pathological chains, like the COVID-19, it should be combined the pathological chains from the common symptoms from the different of the disease location for the lungs or for the different location, 脏腑. Another 12 is the 6 meridian syndrome. And point 13 is differentiation of disease location and disease features, disease data, meaning of diagnostic thinking method, disease name, diagnostic general approach of diagnosis. Okay. Disease category and knowledge about a common disease, relationship requirement for syndrome name diagnosis. 14 is to understand the writing regulation for Chinese medicine medical record. The writing format of outpatient, including the writing requirement for chief complaints, present history, disease syndrome diagnosis. Why we want to come for this point is the requirement. Since it's the traditional Chinese medicine is going to be the evidence-based, all the record is very important. And in the future, if all the practitioner develop for the IT, the technology, the internet, the record, or the new technology for the management clinic. So this is the standard of the regulation for writing regulation for Chinese medicine medical record will become very important. Point 15, to be able to make a diagnosis for common clinical syndrome with the diagnostic methods that take the main syndrome as center with comprehensive analysis for full examination and comprehensive skills, including various syndrome differentiation methods. So from this is the diagnostic of Chinese medicine competency. Third part, Chinese material medical. The unit descriptor to master the basic theoretical knowledge of Chinese materia medica, the best knowledge of various Chinese medicine, the properties and action, function, clinical application of common clinical of representation Chinese medicine, to preliminary possess the ability to select and combine Chinese medicine according to disease and syndromes. This is the elements. There are include the how many major parts the elements here. Total are the 6. We total give the 5. In this 5, the herbal medicine, we try to keep the more common uses herbal medicine. In the curriculum, there are 300 kinds of herbal medicine, but we choose the 150 basic herbs in the competencies. So what the herbs you need to know, the elements include here, the basic theoretical knowledge of Chinese medicine of nature and flavor, meridian, tropism, ascending, descending, floating, sinking, toxicity, and its clinical guidance significance, the combination and contraindication of Chinese medicine, the objective and method of processing of Chinese materia medica, the significance and basis of dosage and usage of Chinese medicine, the basic definition, characteristics of properties and actions, indications, application and combinations, category and precautions of various Chinese medicine, the properties and actions, functions, indication, application, important combination, spatial usage and dosage, precautions of 140 common clinic or representative Chinese medicine below. So this is the 140 kinds of herbal medicine we mentioned below. It should be the basic and minimum should be included in the standard. So I don't want to repeat. This is the 140 kind of herbs. Besides the 140 kind of herbs, we add on the should master the comparison and contrast of 20 group of Chinese medicine with similar function. This is for the Chinese formulas, prepare for Chinese formula, and is the necessary for the Chinese formula later. So this is the 20 group Chinese medicine. Their comparison and contrast should be understood. So this 20 group, we attach the 20 groups of herbs. The first unit of the force, number 4, is Chinese medical formulas. For Chinese medical formula, the unit descriptor is to master the combination theory of formulas and common representative formulas to fully understand the methods for the selection of Chinese herbal medicine and to combine formulas in clinical Chinese medicine, to have the ability to analyze the applied formulas under the guidance of theory of Chinese medicine formulas. The elements here, first point, the relationship between the formulas and treating methods, formula formulation, and rules of change in application to understand the basic meaning of common treating methods. So there are the 8 methods. The main functions, application range, and precaution of various formula. The composition usage, functions, indications, significance, and characteristic of combination, essentials of application, and precautions for 80 common formulas below. These 80 common formula, they are include the Chinese internal medicine, Chinese gynecologists and pediatrics, all the internal medicine, even some of the dermal disease, they are included within this 80 common formulas. I forget to mention one, the herbal medicine. The name we give the 3 names. One is the Chinese pinyin name, Latin name, English name. So in the future, any development of the curriculum, you can base this the standard to refer. The same in here for the formulation. We include the Chinese pinyin, the formula name, and then the meaning of the translate to the English name for their function. So there are all the 80 formulas here. Besides the 80 formulas, there are the composition, function, indication, and essentials of combination of 40 common representative formula. Is the optional, but we include in the standard for the guideline. There are 40 common representative formula here we attach. So when finished, those is the unit for the basic series of Chinese medicine. The clinical skills in the traditional Chinese medicine should be included as below. The first is Chinese internal medicine. The unit descriptor is as below. To master the basic knowledge and skills in diagnosing and treating Chinese internal disease, the causes, mechanism, syndrome differentiation, and treatment of common Chinese internal disease. From the competency standard of TCM, if you are talking about the clinic subject or clinical skills, we're just talking about the internal medicine. But in the internal medicine, if you are not available the 4 units of basic Chinese medicine as the holistic approach and syndrome differentiation, you are not able to practice. Even you know the Chinese internal medicine, you are not able to practice because all of internal medicine, it is a combine all of the skill, all of the knowledge you have learned, or that you have to study, and with your capability to able to be the practitioner later. So that's the why we're talking about the clinical skills. In the first is the Chinese internal medicine. In Chinese internal medicine, the elements is the first is the outline of syndrome differentiation and treatment of Chinese internal medicine. Actually, to apply the basic Chinese medicine series and for diagnostic of TCM and include the formulas and Chinese herbal medicine, materia medica, then you're going to come out the determination of the treatment. So second is the therapeutic principle and common treating method of Chinese internal medicine. Of course, the competency include the definition, cause and mechanism, diagnosis point, and syndrome differentiation, and treatment of common cold. We list of the Chinese internal medicine disease term. This is include 2 aspects. One is it's a Chinese TCM disease name, and some we see the syndrome's term and pattern. So you can see common colds, cough, wheezing syndrome, dyspnea syndrome, palpitation, chest impediment, insomnia. So this is the different disease name and syndrome. Point 4, the definition, cause, mechanism, diagnosis, point, syndrome, differentiation, and treatment of lungs distension, pulmonary tuberculosis, stuffiness, and fullness, and syncope. Maybe someone asks why we need to include the pulmonary tuberculosis here in the treatment. You should know Chinese medicine, of course, such kind of the disease, they should have specific Western medicine for it. But as we understanding those disease going to affect to the patient's immune system, the energy, and side effect of Western medicine. So Chinese medicine can work with those is the condition very well. Even the cancer, I believe all of practitioners, you have very good experience with some cancer treatment. The point 5, the identification of similar syndromes in following groups. So common cold, influenza, wheezing syndrome, dyspnea syndrome. So it's based on the different syndrome. In the Western medicine, they don't have this syndrome, but in Chinese medicine, we include it. And point 6, to fully master the application of 4 examination, inspection, listening and smelling, inquiry, palpation in clinical internal medicine, and the basic skill including diagnosis of treatment routines and treating methods for common internal disease. The second of the clinical of skill here standard is for the gynecology of TCM. The unit descriptor is to master the 4 examination methods, syndrome differentiation, treating methods, characteristics, and methods of medicinal administration in Chinese gynecology. The causes, mechanism, syndrome differentiation, and treatment of common gynecological disease. So this element, we include the 6 points here. The first, the relationship between the menstruation and Zhangfu organ, meridian, collateral, qi and bra, tiankui and uterus. Point 2, the definition, cause, mechanism, diagnosis, differential diagnosis, syndrome differentiation, treatment, prognosis, and overcome of menstrual irregularities. So those is all the disease include. Point 3, definition, cause, mechanism, syndrome differentiation, and treatment of intermenstrual bleeding, postmenopausal, hemorrhage, discharge during pregnancy, everything, the retention of urine during the pregnancy, postpartum fainting due to the hemorrhage, okay. Postpartum conversion, postpartum retention of urine, and postpartum discharge. Point 4, definition, diagnosis of syndrome differentiation, and treatment of symptoms during the menstruation. Point 5, the integrated application of 4 examination of inspection, listening, and smelling for the common gynecological disease. The indication, contraindication, methods and steps, and clinical significance of common diagnosis technique and spatial examination in gynecologists. Pediatrics of TCM. This is the third of the clinical standard. Unit descriptor to master the 4 examination, syndrome differentiation for the Chinese pediatrics. The elements here, physiological and pathological characteristics of infants, the feeding and healthcare methods for infants, the cause, mechanism, syndrome differentiation points, and syndrome differentiation and treatment of common disease for the children, for the pediatric. The onset, cause, mechanism, syndrome differentiation and treatment to preventive isolation measures of measures, tubular, scarlatina, varicella, mumps, and whooping cough. The cause, mechanism, and syndrome differentiation and treatment of fetal jaundice, the fetal jaundice. The definition, diagnosis, and treating principles of the strategy. Osteoinosis, all the disease, the more the common disease, I don't want to repeat here. The great application for full examination of inspection for the pediatric, for common pediatric disease. Okay. And fourth of the clinic skill, acupuncture, and moxibustion. So since there is the existing competency standard for acupuncture by the Pitahc, so this part we just follow and refer the competency standard of acupuncture in the Pitahc. So we are not repeat here. For the fifth of the clinical skill Chinese trainer, the unit descriptor is the master essential points of basic manipulation techniques of trainer. The characteristic of examination and treatment methods. Treatment methods of common disease in clinical trainer. The elements here, point 1 is indication and contraindication of trainer. Understand the action of principles, treating of principles and methods to understand the common assistance methods and the prevention, the handle of the trainer accidents. Essential points of basic manipulation technique for various categories, such as the sway, friction, vibration, pressurization, wrapping, and their application on the human body. The essential points of manipulation, clinical application, and precaution of joint moving category. Common acupoints and manipulation in infantile trainer. The course, pathologic examination, diagnosis, and trainer treatment of strained neck, scapulohumeral for the cervical spondylosis, acute sprain for the different disease. The trainer, I don't know, here maybe I repeat a little bit. What is the Chinese medicine trainer different from the massage? The first, Chinese medicine trainer, they still need to base on the principle of the Chinese medicine, which is the light acupoint and by the certain of the manipulation. So they have some common with the massage. They have different, it is by the theories will be the different. Okay. The last one, there are it is the theoretical knowledge and application of classic of Chinese medicine. We put this competency is the option. It means that in the future, this part, if you set any curriculum for the training or refer this the standard, you can adapt it, you can consider not adapt it. But we recommend to adapt it since it's the Chinese medicine theories coming from those is the classic. And they can guide us for the some special of the treatment and some special disease, like the COVID-19 disease. They get the idea and principle from this is the classic Chinese traditional Chinese medicine. So in the unit descriptor, to select no less than 3 subjects among the Huangdi's internal classic treatise on cold damage and miscellaneous disease, synopsis of the golden chamber. detailed analysis of worm disease, classic of the difficult issues, treasure mirrors and oriental medicine, golden mirrors of the medical ancestors, to master the academic source, theory system, and basic contents of classic of Chinese medicine, and understand the important original text quotation in order to lay the foundation for applying classic theories to clinical practice. And this is the classic Chinese medicine. They are very important. Once you go into the Japan's the dosage formula, they only adapt from the classic Chinese medicine subject. So we provide a standard to help for the globalization of TCM development. The elements include the Huangdi Internal Classic. Okay. Second is the treatise on cold damage and miscellaneous disease, 伤寒论, 伤寒杂病论. The third is the synopsis of the golden chamber. Four will be the worm disease. So worm disease, right now the COVID-19 is the more of the formulas and principles and idea is coming from the worm disease. Okay, so this is the our major of the 10 units of competency standard to become of the TCM practitioners. Here we are going to send the acknowledgement, the first to the Philippine Society of Certified TCM Practitioners and Acupuncturists, to Commission on Higher Education, Philippine Institute of the Traditional and Alternative Healthcare. Next, I give the very short time for the guidelines for certified Chinese medicine dispenser. These medicine we can suggest to give certification to those pharmacists who work in the TCM pharmacies. So those are pharmacists who work in the TCM pharmacy, or the helper or workers or the staff who work in the TCM or Chinese medicine drugstore as the basic requirement. So in here, Chinese medicine, herbal medicine include the following product types: raw herbs, decoction of single or multiple ingredients, extracts, powders, granules, pills, tablet, or capsules, compounded topical preparation including the washes, liniments, ointments. These domains cover the knowledge, skill, and attributes a Chinese medicine dispenser requires to practice independently. Chinese herbal dispensers operate in dispensary clinic or shops, drugstore, and dispenser herbal medicine according to prescriptions from Chinese herbal medicine practitioners. So there are two key capability certified Chinese medicine dispenser are able to do. And in enabling components certified Chinese medicine dispenser. This guideline dispenser we refer from Australia government guidelines for Chinese medicine. So it should implement safe and effective Chinese medicine dispensing. Understand the comply with the legislation and guidelines relating to safe, effective use of Chinese herbal medicine. Apply Chinese medicine theories and practice relevant to Chinese herbal dispensing. It means after doctor prescribe your medicine, in the pharmacy of Chinese clinic, Chinese medicine clinic, at least people know the theories of Chinese medicine, able to explain some concern from the patient, and know how to put the labeling and how to know the contraindication, and know how to know the Chinese medicine. There are many fixes. So complying with the appropriate procedures for compounding, dispensing, labeling, record keeping, and safe storage of Chinese herbal medicine. And check the prescription to ensure it is in date, includes the relevant and correct patient's, client's details, includes the correct prescriber details. There are no errors in the name of the herbs, dosage, and preparation instruction, or if there are any potential safety issues, and communicate with the prescribing practitioner when needed. Consider the risk, precaution, and contraindication of the use of Chinese herbal medicine when dispensing herbs to patients and clients. So even the OTC, even the Chinese medicine, the later, if the Pitahc is able to get authority to issue the CPR for the traditional medicine, including the Chinese medicine. So our guideline at least able to provide some of the dispenser who give the OTC able to know the meaning of the Chinese medicine term. So they need to consider the interactions between the herbal and pharmaceutical medicine with other complementary medicine when dispensing herbs to patient, client. Okay, effectively prepare and provide herbs in the form specified on the preparation. Ensure a complete and accurate label is placed on dispensed herbs in line with relevant state territory legislation. So depending on FDA, we still need to follow the FDA regulation. Provide clear verbal and written instruction to the patient's clients on the correct usage and method of administration of the Chinese herbal medicine. So for example, Chinese herbal medicine include the internal, the oral medicine. They have some of external use medicine. So those is the pharmacist or the who under the training, they can give very clear, accurate the instruction to the patient and clients. For the clinic, so for the clinic competency, because right now in the Pitahc there is acupuncture competency standard for the acupuncture clinic. So our group, the technical working group, we are going to get from the copy from Pitahc, then we develop very soon can develop for competency for the clinic for this all. This is all I going to report to all of our colleagues for this afternoon. Hello, Debbie. Yeah, I return to you.
Okay, thank you so much, Dr. Yes, doc. Thank you so much, Mr. Qiming Zheng. Okay, so before we start with the open forum, just to inform everyone that we are currently airing live on Facebook right now. And let me first recognize and do a roll call of our distinguished participants. We have here Dr. William Ko, Chairman of Foundation of Traditional Medicine. We also have here Ms. Janet Paredes with us, Sir Francis Gomez, Dr. Tan Chuchung, of course, Dr. Butch Ong. Okay. We have a lot of participants right now. We have 92 active participants. We have Miss Elizabeth So. If it's okay, can you turn on your video camera so that we can see your beautiful faces? Miss Maria Tan, there you go. We have Miss Michelle Yu. Okay. So participants from the SMIC. Okay. We have here Sir Philip Tan Gatwe is with us. Okay. All right. So Without further ado, let us move forward with our open forum. To help us with the open forum, let us call on Dr. Francis Ras to be assisted by some Pitahc officers who will act as our moderators for this afternoon's consultation. Dr. Ras. By the way, Dr. Ras is our certified medical acupuncturist, and he is also the division chief of social advocacy and training in Pitahc.
Good afternoon, everyone. And in behalf of Pitahc, we would like to thank Dr. Qiming and the group that includes Dr. Zheng Yu, Dr. Ed Concepcion, Dr. Iris Chelsea, Dr. Fatima Lautan, Dr. Yating, Dr. Wan Liu for the preparation of the competency standard for traditional Chinese medicine. So for time management, we are now open to any questions, suggestion, comments regarding the presented competency standard.
Hi, good afternoon. I'd just like to may I ask a question?
Okay, go ahead, Sir Tangat.
Yes. Just I'd like to look at one item in the definition of terms. There was one that says Chinese medicine, and then it went on to describe the the plants, animal parts. Could we take a look at that? The definition of terms.
Can we turn on again the share screen
So we can discuss. So everyone who knows me knows I'm a stickler for definition of terms. There's a part there that's Chinese medicine.
Number 8, Chinese medicine. Yes. It is generally composed of plants or a part of plant, bark, leaves, fruits, etc., or plant derivatives, animals, insects, or minerals.
The word kasi actually, if I may make a quick suggestion lang or a question, wouldn't the term, kasi we already use the term Chinese materia medica later in the standards, shouldn't we use the same term there? Kasi when we say Chinese medicine, we use the word medicine to mean the science, and we also use medicine to mean the materials. In Chinese, we have one word for the science, xue, and the materials, yao. So if we define Chinese, we have the term traditional medicine, traditional Chinese medicine, and then which refer to the science. And then when we say when we say Chinese medicine, referring to the materials, it might be a little confusing. So that's my first question. May I suggest, referring to it as
Dr.
Chinese
Philip,
materia medica?
You're suggesting to delete the definition of Chinese medicine, or replace it with Chinese materia medica?
Replace the term Chinese medicine with Chinese materia medica.
Okay. So, Dr. Qiming, any comments with regards to the suggestion of Dr. Philip Tangatwe? Or Dr. Zheng Yu? Any comments with regards to the suggestion of Dr. Tangatwe?
Okay, for those who want to speak, do not forget to unmute your microphones.
Dr. Ras?
Yes.
This is Annie from INAM. To be consistent with the content, with the content of that definition, can we just use the term Chinese herbal medicine? Just thinking about the name, aside from the suggestion of Dr. Tangatwe. Thank you.
Yes. Thank you, Annie. So we are waiting for the comment of Dr. Qiming or Dr. Zheng Yu, Dr. Ed Concepcion.
Can I answer Dr. Tangatwe and then from the INAM?
Yeah, the question of Dr. Tangatwe is to delete the definition of Chinese medicine, but instead replace it with the Chinese materia medica?
We have maybe we can think about how to more accurate, but we cannot remove this is the Chinese medicine, or we can see we cannot use this the only herbal medicine, because before we used herbal medicine, but for some of the group member have a concern, because since it's a Chinese herbal medicine, it is not only the herbs, they include other even the minor. But I think Dr. Tangatue give a very good question about it. So we will think about it. We can discuss what is the more accurate. But if you only herbal medicine is the from understanding, it will be okay. From the term, maybe there will be problem, particularly in the FDA. In the future, we need to meet with the FDA terms. So if the FDA, they have a herbal medicine, they have a traditional medicine, but TCM, Chinese medicine, is still the specific, the list coming from the pharmacopoeia in China. So this we try to copy from this one. But we know the concern of the doctors. I believe we can find the solution from the group, or even Dr. Tangatue, we can give us some suggestion later, but we will see what is the more accurate. We got the concerns, and thank you very much for these concerns. But I cannot answer you immediately what should be. But I still consider Chinese medicine term should be there. Yes, thank you.
Yes, thank you. I think, Annie, for your question, because when we speak herbal medicine, it only deals with the herbal, but what about the other component such as insects and minerals? So it's really a Chinese medicine. So you cannot use the Chinese herbal medicine for this. So Doctor, thank you so much, Dr. Qiming Shen. So Dr. Peter Tangatue, is it okay with you?
May I? I'm William S. Ko. May I say something?
Yes, Mr. Ko, William Ko.
Yes. Actually, I'm agree with the using the term of traditional Chinese medicine. As you know, the Chinese medicine is not only herbal. There are a lot of animals, just like one of the components of the major components of the Chinese medicine is Liu Huang. That's very important for all the kind of Chinese medicine. So it is from the animals, from the cow. So I'm agree, traditional Chinese medicine, it is the right term.
So there was a suggestion, traditional Chinese medicine. Dr. Qiming Shen, any comment for this?
Yes, actually, thank you, Dr. Ko. I think it's a good idea. The TCM term, we check the World Health Organization. TCM, if you use the traditional Chinese medicine, there are two meanings. One meaning is the theories of the traditional Chinese medicine. What is the medicine itself? So actually, the first time we put there, but we just don't want to make a little bit confused. The one is the theory. So we put the two. The TCM, if the theories, they include the modality of the internal medicine, acupuncture, Trina, and then the
different modalities of
the different modalities.
Chinese medicine.
So, but if not in this is the competency, only talk about the medicine. Usually, as the Dr. William Ko we mentioned, we just put the TCM more specific. But here we want to separate, and so we check with Singapore, Australia, in the different country, and we consult the World Federation of Traditional Chinese Medicine Societies, what they are placed what is how to put it in the different. So yeah, maybe the other people can give more idea about it. Thank you. Thank you.
So
Yeah.
we will know.
Hello.
So the group will just conclude with regards to the term that will be used for to replace the Chinese medicine. Okay. So thank you so much, Dr. Qiming Shen. So any other question now?
Dr. Francis Rush, Jimmy, can I make a comment? This is
Yes.
ID.
Yes, Dr. Ed Concepcion.
I think we included that as a number 7 item. Chinese Materia Medica.
Yes.
We defined Chinese Materia Medica earlier, if I'm not mistaken.
I think the definition was not, it is not included in the definition.
It's not? Chinese Materia Medica?
Yeah, the Materia Medica was not included in the definition, but it was placed, I think, under the herbal medicine. Under the herbal medicine. A unit of competency standard of practitioners. So
is it not there in number 7 item?
Yeah, Chinese the Materia Medica.
Medica.
Yeah, 7 point. Yes, Dr. 8, you are right.
Yes, Chinese Materia Medica. Chong Yao Shui.
Yeah, the number 7 there is included already.
Yeah,
Let's talk about the unit of
Chinese Materia Medica.
Yeah.
let's talking about
did we define it and did we include that in the definition of terms? That I don't remember.
Yeah, it's not included in the definition. Yes.
Okay.
And then there's the other concern that was raised, because we might have problems with FDA if you use that term, because they don't use that term there. FDA does not use the term Chinese Materia Medica. Am I correct?
Yeah.
Yes.
I think so.
Yeah. So this is a legal question. I don't know if Attorney Chia can help, because can we do that in our guidelines and then so that the FDA can adopt? This is a matter of process, no? Even the definition of terms, even if, because the problem is FDA already has a set definitions, no? And this is not part of it. I think they have on herbal medicine already, and they even have Chinese medicine, but I don't remember seeing the words Chinese Materia Medica in there.
Thank you so much, Dr. Ed. So we will confirm this with our representative at FDA, si Miss Pia, because the traditional medicine will now be actually it's not regulated, but the Pitahc will not regulate the traditional medicine, but we will recommend to the FDA. So we will ask Miss Pia if what is the appropriate term that we will include in the definition of Chinese medicine or traditional Chinese medicine or Chinese Materia Medica. So we will finalize this one with Miss Pia. Is it fine with everyone?
Yeah, I think it's good.
Okay.
Thank you.
Thank you so much. So other question?
I also want to ask a question.
Please recognize, please.
Good afternoon, Mr. Fassman.
Yes, sir.
I just want to ask a question because I've read a while ago that we are aiming to gradually integrate this in our healthcare system. Am I right?
Yes, sir.
Yes, and I can, but however, for the standards which is actually stipulated for TCM practitioner, there were no requirements for the basic medical sciences that a TCM practitioner has to study before they can practice. And it would be a big problem if we will integrate this in our healthcare system if they don't know about basics about medicine.
So, any comments for the from the participants, in medical doctors?
I can see Miss Janet Paredes from here waving her hand. Yes.
Yes.
Yes, Miss Janet.
Francis, can somebody give some clarity? No, I am representing non-medical acupuncturists in the Philippines. And this is the first public hearing. And I noticed when I received this document just a few days ago, now there is a new organization which is called Philippine Society of Certified TCM Practitioners and Acupuncturists Incorporated. And this is in line with Sharif's question that, of course, we already had competency standards for acupuncture and for TWINA. Now, I think you need to clarify because it indicates also here particular aspects of TCM practitioners wherein, like what Sharif is saying, it includes medical sciences. No, I think that's what he was referring to. So can somebody give some clarification, clarity, some history on this particular organization? And because we're going directly to the Chinese herbal accreditation or integration into the healthcare system or in TCM perhaps, because I know that Chinese medicine helps a lot in so many different conditions. But the problem here is it's imported. We have problems of availability, accessibility, and affordability in the Philippine society. Whereas I don't know, and I would like to push also Philippine herbs that can be done into research so that we can make use of our herbal plants and dietary mga medicinal foods that we can also make use, which is, I think, more affordable to the majority Filipinos in the Philippines. That's my take on this. At first, this organization, this is the first time I heard of it. And I wonder if it's also accredited by Pitahc DOH at this point in time. Medyo maraming points, pero we need to clarify and so that the public and all other TCM practitioners, especially the non-medical, can be clarified on this matter.
Yes, we would like to ask the group, the society.
Okay, I will be one to answer this one.
To give a little background of the Philippine Society of Certified TCM Practitioners and Acupuncturists. Yes, Dr. Qiming Shen.
Yeah, this is coming from the 2005. I work with the TCM practitioner here in the Philippines. Actually, since it's the 400 years ago, is when the China with the Philippines have the trade, the Chinese medicine entered to the Chinatown. The generation to generation, the Chinese community start to practice Chinese medicine. But after that, because of the regulation and then the herbal medicine FDA changed if some of the guideline, the regulation. So it means the TCM part is the brown there, and there's the gray zone. But whatever you agree, you don't agree, there are many of even the Western doctor in the Philippines went to the China to learn the Chinese medicine. So the market is the demand. The Chinese medicine is a part of the culture of the Chinese culture, the TCM. So of course the acupuncture more popular, but the herbal medicine, because of since the FDA changed the regulation, they are not released any Chinese drugstore for the herbal medicines. But during the 1997, the create by the Republic Act 8423 create the Pitahc. That's the times Pitahc going to start to give the rules and regulation for acupuncture and right now for Chinese medicine. So 2005, I organized the traditional medicine basic course and acupuncture in the UER and MMC. We have the 4 batches in the UER and MMC 2005. So during the 2005, 2007, 2006, Pitahc the passed to approve the accreditation of acupuncturist, but it's still not yet to able to complete off for the TCM. So from the 2005, after that, they still have many, in the today's, we have many practitioners, they went to China to study acupuncture, to study Chinese medicine. So you can see all the acupuncturists you studied, it is impossible separate from the Chinese medicine study. You still take a part of the very small basic of Chinese medicine. In 2009, we registered from the SEC for the Certified Society of the Philippine Society of Certified TCM Practitioners and Acupuncturists. Those the doctor or practitioner most of come from China who study the regular and full course of TCM and who practice here, or who has get the acupuncturist from by Pitahc accreditation and practice here as the acupuncturist and prescribe the Chinese medicine. I think it's the good timing to let us work together. I still believe TCM is the umbrella to include all of the modality of the traditional Chinese medicine. So acupuncture is still a major part of traditional Chinese medicine. Okay, if you only develop the acupuncture here, you are not develop the TCM of the standard or the practice here. Your acupuncture practicing will lack of the root of the academic level. So this is our group in our society from the Dr. Liu, Dr. Senong Liu, they start SMIC. We provide the first is the full course of traditional Chinese medicine. And right now, Fujian University of TCM, we are going to set up another training course. Even myself worked the several batches with the Pitahc for the TCM practice, but only the short-term course. So what do we want to do? We want to get a more academic level for the acupuncture as the Janet mentioned. So what is the research? What is this in the future, the development for the further development? This is umbrella should be there. So TCM should be there. If TCM, and TCM is the first one in our background, we mentioned the point here, the ICD 11 from the World Health Organization first time include the traditional medicine, particular TCM, in the disease category. Before it's never happened. So compared with the Asian country, our TCM rules or regulation is behind with the other country. So TCM as a part of traditional medicine, I think it's the good timing to work together to going to give the idea. So how is this no TCM competency? How can you certify? How can you accredit? How can you do everything? So we want to complete, this is the concern. We come out this one first, everything Janet nation can follow. Okay, so first the society is the legally registered in the SEC, and then all the group, actually our group, I can say 90% are registered accredited acupuncturist, but our practice not only acupuncture, we more in the traditional Chinese medicine, even the Tuina. So this is my answer to everyone. That's why we submit this competency to train and then get this Pitahc understanding. So I can get the any comment and some of the initial additional comment from the Dr. at Conception. Thank you.
Just a minute, Dr. Ross. Good
Yes,
afternoon.
yes, ma'am. Good
From what I
afternoon, ma'am.
understand from Janet's question, maybe she maybe would just like to clarify. Maybe she is asking about the accreditation of the organization. Am I right? The Philippine Society of Traditional Chinese Medicine.
Yes, yes.
So to answer this, we'd like to ask jurist and attorney Chai to elaborate further about the accreditation of organizations. Jurist or attorney Chai?
Yes, good afternoon. Yes, ma'am, this is Jurist. Yeah, actually, the Philippine Society of the organization of Qiming is not yet accredited. They have not yet applied for Pitahc. So, for information of Janet, hindi pa po sila accredited. They have not yet applied yet. Siguro yung regarding dun sa question mo, kasi we already have certification and accreditation requirements for acupuncture. Same also for Twina massage. Parang ang mangyayari, for those who would want to pursue the TCM, the whole system of TCM, it's now the, I mean, those who would be interested, they can apply, but they have to have further studies. Right now, the SMIC is offering a course on the entire TCM course. So at the moment, I think there are only 2 graduates of TCM from SMIC. So siguro we have to come up with a more detailed guidelines on how to really certify a TCM practitioner. We have to elaborate on it pa, hindi pa ganun kaano. Sa guidelines, maybe we can elaborate it in the guidelines.
Sorry, may I just ask a question to clarify what this perceived system is going to be? Is it just one question? In other countries, for example, in Canada or in Indonesia, it's 1 by 1. Like you're an acupuncturist, you're an acupuncturist. You're a herbalist, you're a herbalist. But if you're going to be a TCM practitioner, you have to have completed like both modules or both parts. Is that what's going to happen here? Like acupuncture under here, Twina under there, and then if you already have those, and then you have further training in the other aspects like herbs, you can have the title TCM practitioner. I mean, I just want to know if that's how it's gonna. Yeah. That's the idea.
Can I follow up on Philip's question? When I was reading this document, what came to my mind was we already have the accreditation, competency standards for acupuncture. Now, this one, there's also another competency standard. And this will lead you if you want to take Chinese herbal medicine. So, dalawa siya, no? Dalawa siya. Like, if you're already a certified acupuncturist and you want to pursue Chinese herbal medicine, will that qualify to study just TCM herbal medicine? You have to take the whole course of a particular school or the one offering this, to be qualified as a TCM practitioner with Chinese medicine background or accreditation. Kasi dalawa tong documents na to, and I'm also looking at the competency standards of acupuncture, which binuno natin yun ng matagal, hanggang sa natapos siya. Pero now this is another competency standards which has all yung acupuncture, Chinese herbs, and everything. So I think we have to be clarified on this, especially non-medical acupuncturists.
Yeah. Thank you so much, Miss Janet, and thank you so much, Dr. Philip. So with regards to your question, so actually it's a separate. So if you will notice with the competency standard for this traditional Chinese medicine, it's more concentrated on Chinese medicine, the herbal, no? Because even in the WHO, the benchmark that was published by the WHO, so they have a separate. So benchmark for traditional Chinese medicine, benchmark for acupuncture, and benchmark for Tuina. So may kanya-kanya, they have their own although the same theory when it comes to traditional Chinese medicine, but they have also a specific number of hours and the different topics, no? So competency theory listed on the different benchmark for different modalities of traditional Chinese medicine. So for this, kasi you will notice it's more of the Chinese herbal medicine, Chinese traditional Chinese medicine. So nako-confuse ako. So we have already the existing even in the standard, you will notice that they also refer to the acupuncture's competency standard of Pitahc when it comes to acupuncture. So then Tuina, I think they have to refer also to the standard of the Pitahc, existing standard of Pitahc for Tuina massage. So siguro ganun na lang po Miss Janet. So talagang this will be a separate. Not as one.
Yes,
the different modalities.
Yeah, but Francis, what I'm driving at is, for example, I'm already a certified acupuncturist and I want to pursue Chinese herbal medicine. I have to comply with all these requirements based on this document so that I can be accepted in the Chinese medicine class and pursue, because I believe in Chinese medicine. It's very effective. So if there are TCM, if there are certified acupuncturists who would want to go into Chinese medicine, how will that be?
So since Dr. Zheng Qiming is the only one as of now offering the course, so we can ask her we can ask her.
Dr. Sister, you would like to answer? They have also that school.
Sister Liu.
Sister Liu is the one who offered the course in traditional Chinese medicine. Yes, Sister Liu. Good afternoon.
Sister, you're muted. Unmute.
I use this one. It's good. We have we started to open or offer the TCM program to the CAs or CMAs. Okay, so that's this year. We just started last month. So actually, we already started for the enrollment. But the condition is we have an entrance exam. It's okay. We honor your CA or CMA certificate. So for you, if you want to pursue as a TCM practitioner, we have all the course here for you. So which means you don't need to take our acupuncture training course anymore. So directly join our TCM program. Is that clear?
Yes, sister, clear.
So it's clear. So if you want to enroll for the traditional Chinese medicine being offered by the SMIC, so you have to take the examination first before they can accept you for the traditional Chinese medicine. Okay?
Yes.
So thank you so much, Sister Liu.
Can I add something there? This Eddie Concepcion.
Yes, Dr. Ed Concepcion.
Yeah, actually, when Qiming invited me to join the PSTCMA, it was very clear that we didn't really have any place to go to, because as far as Chinese medicine is concerned, it's just acupuncture that's still recognized by government. So in terms of accreditation, it was really very difficult, the situation we were in. So, and I don't know if I should be thankful, but because of the COVID-19, all of a sudden, herbal medicine needs to be recognized because of what's going on. But when we were framing the guidelines, it was very clear that we did, if you notice, we didn't even tackle acupuncture because it was a tacit, it was an agreement among us that we will be adopting the guidelines of acupuncture. And it will be incorporated. We were assuming that once you're a traditional Chinese medicine practitioner, you should know acupuncture also. So that's the idea behind when we frame this. So it's not going to be an exclusive club. It's going to be, because of the situation we're in now, it's going to take on the whole caboodle of Chinese medicine and not just acupuncture. And that's the reason why now, in the school that we put up, we're accepting even those who are graduates from other schools who have trained. But we just have to make sure that you pass the qualifying exams. And that's it. Thank you.
Thank you so much, Dr. Edcon. So
Dr.
any other
Ras,
question?
I believe the question of Hasiman, Sir Hasiman, has not yet been answered.
Can I answer it?
Yes, go ahead, Dr. Qiming.
Okay. Regarding the medical background or regarding the medical practice? Yeah.
No, I'm actually asking, sorry to interrupt. I was actually asking if benchmarks, if you want to become a TCM practitioner and if you compare it to China, like for us, because we are graduates from China, we took an 8-year TCM course in China, a TCM degree in China. So we have, before we can be a TCM practitioner, we have to study the basic medical sciences because China is aiming to integrate it in the hospital. So you cannot be a TCM practitioner if you don't know how to manage basic medical practices inside of the hospital. So if the Philippines wants to aim or to project the TCM practitioners to gradually integrate it in our Philippine healthcare system, I think there is a need for us to address the issue of the basic knowledge, what are that the TCM practitioner have to conform with the Western doctor. Because there are certain practices by TCM practitioners that has to be in conformity with the Western treatments. So if TCM practitioner in Philippines does not know these things, it would be so hard for the Philippine Medical Association to acknowledge or recognize our efforts in the Philippines. You know, I'm just thinking a little bit big because according to the RA 8423 or the TCM law, the TAMA law, we are aiming to integrate it in the Philippine healthcare system. So I was asking if our standards or our requisites to become a TCM practitioner is in conformity or in accordance with our aim to integrate it in our healthcare system.
Could I answer in behalf of Pitahc?
Yes, ma'am.
Siguro for now, although we'd like to integrate all the other modalities, like acupuncture is basically Chinese, Tuina massage is also Chinese, traditional Chinese medicine is Chinese, anthroposophic medicine and homeopathic medicine is European, as well as osteopathy, that's also European. So only Hilot is innately Filipino. But we'd like to integrate all this into the Philippine National Health Delivery Program or National Health Delivery Service by integrating these programs first into Pitahc to be accredited. And then after that, slowly by slowly, we are introducing these different modalities to our hospitals through the Hospital Congress that we conduct every year. But for us to practice in the hospital setting, it might be quite far yet because with the universal healthcare law, we first have to be integrated into the HTAC system, which is the health technology assessment system, which means that everything that will be reimbursed by universal healthcare law has to pass through research and development. So that's why this early we are already admonishing all the modalities to practice research. Like homeopathic practitioners, they came up with a treatment protocol. They want to use it for COVID-19. We ask them to do a research, do case studies on your patients. Then we will gather all the case studies. We will make it into a case series. Naturopathy also would like to promote their herbal blend. So we told them, if you want to use it in your own patients, then we'll do a case studies on your patients. Then we'll group it all together and form it into a case series. So the same with traditional Chinese medicine. In the next few weeks, we will be receiving donations of traditional Chinese medicines from the Chinese embassy. So the advisory group of the traditional Chinese medicine practitioners will be the technical working group for these traditional Chinese medicines in a MOA, which we have crafted with FDA. But we are also suggesting that the traditional Chinese medicine practitioners will use these donated medicines also on your patients with COVID. Then document it, do case studies, gather it, then make a case series. If you're experimental, then you can do clinical trials, double-blinded, placebo-controlled, and Pitahc can help you in that area, whether a technical or funding. But for us to be fully integrated in that you will practice in the hospital setting, we are still a far way off. Nasa baby steps pa lang tayo. So it will take a lot of effort, and maybe one of the first steps also which you have to support us in this endeavor is we are asking for the quasi-regulatory powers for Pitahc. Because right now, if our practitioners will not register with us, then we cannot certify you, we cannot certify your practice, we cannot certify your organization. But there are those who are practicing out there. They have not been even trained. They call themselves doctors of naturopathy. They sell products that are not even FDA accredited, and we cannot run after them. So in order for us to assure the public that what we are doing is legitimate, you have to support us in the RA 8423 amendments. We already have our champion in the Senate, that's Senator Bongo and Senator Manny Pacquiao, and we also have our champion in the lower house, that is Congresswoman Angelina Tan, the chair of the Committee on Health. So those will be our baby steps, and we are also slowly integrating ourselves into the health technology assessment system so that later on, when we do our CPGs, we are doing our CPGs right now for acupuncture, we can already integrate ourselves into the universal health system, and we can already get reimbursements. Okay, thank you.
So po ma'am, if we are a TCM practitioner in the Philippines, based on your explanation, then it would be very impossible for us to practice in other states, like in the United States, in Singapore, and in other countries, isn't it?
We cannot answer for the United States, but there is an ASEAN agreement. Next week, we will be meeting with the rest of the ASEAN countries. There is an ASEAN agreement in which practitioners of accredited medical centers in the Philippines, or maybe even in traditional and complementary medicine, if you are an accredited practitioner, you can practice in the other ASEAN countries. In the same vein, their products can also be accepted in our country, as well as our products can also be accepted in their country. I will not maybe dwell on that because we still have a meeting next week. We will be meeting with the ASEAN committee on the practice, on the products, and on the practitioners of the NCM. Not in the United States, they have their own laws and regulations. I can only answer for ASEAN.
Okay. And one last question po. Do we intend to partner with universities in China for us to be recognized? Like for us, because we are graduates from China and we take an 8-year full medical program of TCM. So is there an automaticity when we go to Philippines to have this TCM registration or certification or whatsoever?
Yeah, that will be part of the program. In fact, Dr. Qiming is collaborating with the Fujian University. Hopefully in the future, we can send our scholars to Fujian University, and Fujian University can also send their scholars to study. Last year, we had professors from Nanjing University. They came and visited the Philippines, and for 2 weeks, they looked around and looked at the practice of TCM in the Philippines. At the same time, also, we sent some scholars to study at the Nanjing University. We're already doing that. We also have collaborations with Shenzhen University, and we also attend their conventions. Also in Macau, and last time we also attended the convention of the herbal garden in China. So we're already doing that.
No, I mean, ma'am, my question is there a guideline that if we are a graduate of this certain university in China, they will be automatically given a TCM practitioner registration or certification? Because that's what in Malaysia is doing. Like there are 4 universities in China that are all recognized, but Malaysian government be given an automatic license to practice in Malaysia. Do we have that?
I think Dr. Kim In Seng already discussed that either you are a graduate of SMCI, the only accredited school in the Philippines for traditional medicine, or you are a graduate of the 8-year program in China. So maybe the technical working group, they can elaborate on what universities they will accept. But I think Fujian University is one of the universities that they will accept.
Thank you.
Okay.
I think based on the question, I believe the first we have to able to have the first competency standard of TCM. So those is the concerns can be answered. Because only for this one should be there, so everything can be improved. This is the why we are doing. And thank you very much.
Hello, ma'am.
Okay, Attorney
Yes,
Chai.
Attorney Chai.
Yes.
Attorney Chai. Nawala.
Yes, ma'am. May question
Ayan.
lang, ma'am.
Okay.
First is dun sa objective of the standards, specifically number 3. Kasi it was stated there to serve as a guide basis for PRC, the Philippine Society of Certified TCM Practitioners and Acupuncturists, in the accreditation of the practice of TCM. Medyo confusing po yung statement because tayo yung the only body who accredit facilities and who certifies TCM, traditional and complementary medicine practice. So with that statement, parang yung PRC and the Society of Certified TCM Practitioners will be the ones.
Statement number 3.
Okay.
Objective number 3, to serve as guide basis for the Professional Regulation Commission and Philippine Society of Certified TCM Practitioner and Acupuncturists in the accreditation of the practice of TCM. So you're suggesting that we delete this statement?
Kasi currently on our setting, PRC, sinasabi naman nila, they have no capacity to certify or accredit traditional and complementary medicine. So yung association naman, they are a private institution.
Yes.
Okay.
So only Pitahc is mandated by law.
Yes.
Because the Tama Law RA 8423 says that Pitahc will formulate rules and regulations for the regulation of the practice and usage of traditional medicine, only Pitahc. And
Yes, ma'am.
with regards to PRC, I am now, we are presently trying to meet with PRCs, with the commissioners. I'm talking with Dr. Ellen Galvez, PRC commissioner. We're trying first to work on acupuncture, on accrediting acupuncture as a subspecialty of medicine. So I think from the point of view of PRC, they will only accredit acupuncture as a subspecialty for medical graduates. So we are now also giving our comments on the revised Philippine Medical Act, which only will deal with also Philippine medical graduates. So PRC definitely will not be able to accredit any of the modality except if they will accept acupuncture as one of the subspecialties of the medical profession. And PRC will not also be able to certify or accredit because it's not in their mandate. It's the mandate of Pitahc as stipulated in RA 8423.
Sige, ma'am.
So we will
Second,
delete now the
We can remove.
from the objective statement number 3. Okay.
then my second comment po is sa objectives
Yes,
pa yun,
Attorney.
yung number 4,
Okay,
instead
number 4.
of basis
Number
for
4
PhilHealth,
is yes.
oo, instead of
Number
basis, kasi hindi po yung competency standards ang basis for PhilHealth reimbursement. There are, based on the Universal Healthcare Law, yung HTA, Health Technology Assessment, was created. They developed criteria in order for technologies, products, devices to be reimbursed. Ang hindi po included doon yung competency standards. So baka pwede nating, instead of basis, it could be used as a reference by PhilHealth.
Or
I think
UHC.
that will do.
Oo.
Yeah.
It could
Serve
be used
as a
as a
basis.
reference. It could be used as a
To serve as
reference.
reference.
Oo, instead of basis. Para po consistent siya sa universal healthcare and yung sa HTAC, yung Health Technology Assessment. Okay po. May comment lang po ako doon sa entry requirement. Yung sa 1.2, ang tanong ko po, graduate of not less than 5 years. What if, like kanina may nag-mention, graduate siya ng TCM for 8 years. Ano po ang basis natin? Bakit sinasabi nating 5 years? So what if I am a graduate of TCM for 4 years, meaning hindi ako magka-qualify? Kasi sinabi po natin dito, not less than 5 years. Ano po ang intention natin for limiting it to 5 years?
Can I answer for this one?
Yes, Dr. Qiming.
Okay. Actually, right now in China, all the medicine, there's not a 4 years medicine. So if the TCM, traditional Chinese medicine, you want to get a license, traditional Chinese medicine, there is the only 5 years. So we get the 5 years. But we are not only based on these 5 years. So we put the or, because, for example, in the Fujian University in the Philippines or SMIC right now is 2,000 hours. So our curriculum is more than the 1,000 hours. So we put another word is here, or with the 550 hours of fundamental theories and knowledge TCM, 680 hours of clinical subject and skills of TCM, and at least 960 hours. So if you are not from the China, it's the 5 years. So in the other school or other country, you just meet this the hours, 550 hours for the fundamental theories or 680 hours for clinical subjects and 960 hours for internship. You can meet the requirement already. No need to just based on the 5 years. But most of right now, we're talking about academic Chinese medicine education, most of from China is the 5 years. So we keep this point and which is the others.
Okay.
So it can be improved also.
Yes, yes. So meaning a graduate of not less than 5 years TCM from Pitahc recognized university.
Yes, yes.
Okay.
Yes, can be.
If you put recognized Pitahc a university, what if he or she is a graduate from
China.
abroad or international
That's why
country? You cannot accredit or certify the university abroad.
Local and abroad.
Local and abroad.
Kasi ang tanong ko po, why do we have to put the 5 years? So, bakit pwede po natin kayang ilagay na lang na a graduate of TCM?
Okay, what I put the 5 years because in China, if you consider the traditional Chinese medicine, in China there are so many of the training program also. This training program maybe the 1 years, maybe 2 years, and this training program you cannot consider as the full course of TCM. So the first is the entry level here. The TCM modality include internal medicine, include the acupuncture, include the trainer, include the gynecologist, include the pediatrics. So this is the full course in China. They not any less than the 5 years. So maybe you can say 5 years in China, because the China right now is just open to the some short-term course, and this is the course in China. They are not allowed to give the licensed Chinese medicine doctor. So that's why we copy from the law of the Republic of China, the licensed TCM doctors law. So we just try to keep the standard there. If everybody go there, just get the hours, 1,000 hours, but only 2 years, but not in the complete course, maybe going to affect to the qualification. This we are thinking about it. But we can revise in here 5 years TCM in China, at least. So let's maybe can do this way if you are from China.
Can I raise a point?
Yeah.
Because I remember Dr. Qiming, I asked you about this too, no? Because it really gets confusing. But I understand where it's coming from. We are trying to differentiate those who graduated from China and those who graduated locally. So it might be better if we separate the two.
Okay, I think it's a good idea.
1.2, 1.3.
Yes.
Just to make it clear.
Good.
That's my suggestion.
Yes.
Because it looks weird if you put together 5 years or 550 hours.
Yeah.
Yes, that's the thing po na I would like to raise. Kasi if you put it in general of 5 years, there might be no qualified Filipino graduate locally.
Yes. You're right.
Tama.
And very good point.
Yun po. So may second lang po ako, tanong pa po, regarding yung sa 1.2, o 1.2, yung 500 hours, ano po ba to? Or cumulative? Dapat he or she should have, if he is not a graduate of TNCM, he or she must have 550 hours of fundamental theories, 680 hours of clinical subjects and skills, and at least 960 hours of internship. Or po ba yun? Or they have to have at least those 550 hours, 680 hours of clinical trials, and the 960 hours of internship.
Yeah, it should be all, not the or. The include the three part, 550 plus the 680 plus 960.
Okay. So it should be 580 hours of theories, 680 hours of clinical subject plus the 960 hours of internship. Tama po?
Yes, yes.
Yes.
Why we put for this way, because right now, who study the traditional Chinese medicine in the Philippines or in the going to the other country? Because most of they are the part-time, they are not the full-time. So we try to more people accommodate for this the entry.
Okay lang po. Sige po. Yun lang po. So kasi nakalagay po doon ay ang hindi ko siya ma-appreciate na they are cumulative. Absence of one would not qualify for certification.
So, okay. Thank you,
Sige lang.
Attorney.
Sige
so
lang.
meaning,
Pero
he or she
may
has
tanong.
completed the 550 hours of fundamental theories and knowledge of TCM, 680 hours of and 960 hours completed. Okay.
Tapos, ang may tanong lang po ako, what if po yung the internship was not completed in 3 years? What would it mean? I completed the 960 hours. However, I did not complete in the period of 3 years. Would it mean that I did not meet the qualification?
Yes.
Why do we have to put the 3 years?
Dr. Qiming, he or she has completed 550 hours of fundamental, 680 hours of clinical subject, and 960 hours of internship. So we will just delete that to be completed in 3 years.
And unless they have
no.
specific reason for
only
putting
for internship 3 years. Internship 960 internship within the 3 years.
Okay. So 960 hours of internship in
3 years.
In accredited Tcm clinic completed in 3 years. So yes. Completed in 3 years. Okay.
I think
bakit nga po? Bakit po? We have to put the 3 years.
Okay. Actually, we count already. If we are not finished 3 years, it means the internship not really consistent. So the practice cannot be refreshed again. So really have the qualification problem later, and your time is not able to internship for the 960 hours. The 960 hours we divide to the 8 hours a day. 8 hours a day is only the 4 months. Or for every, so it's very short. We divide to the, if you're not able to finish within the 3 years, it means you are not able to recall all of the knowledge, all of the skills you have learned. So some country 1 year, 2 years, we consider the practitioner here the part-time. We place the biggest is the 3 years. We consider the different country is the maximum is 3 years, so we adopt the 3 years.
Okay po. Kasi if you have to put it the 3 years, it would not be consistent in the 1.4 in the provision on the limitations.
Yes.
Kasi you have provisions there in limitations, so you have to harmonize it with the 1.2.
Yes.
Can I say something? Hello? Hello? Can you hear me?
Yes. Yes po.
Hello? Hello? Hello?
Okay, go ahead,
Dr.
Dr. Tan.
Dr. Tan Chichong.
Yes, Dr. Tan Chichong.
I think I get the point of Dr. I think it should be within a year, because number one, before one undergoes internship, that is to say, one has already finished the didactic side of the course. So I think immediately we should be able to finish. One should finish the internship within a year, because if it's 2 years or 3 years, I think it's too long. So maybe it should be within a year, because if I have my internship within a year, that means the basic theory is still fresh in my mind. So if I make it 2 years or 3 years or even more, then the focus and the application of the basic theory to clinical practice is too long. It can be diffused. So I think it should be within a year. So that is to say, whatever the school should be able to accomplish this and to imposed that the student should be able to finish internship within a year. 3 years, I think, is too long. Like in our medical school, in our even the nursing school, immediately after the basic didactic classes, it's within a year that they finish the internship. So I think 3 years is too long. I would like to propose it should be within a year. So any comment about?
Yeah, can I answer Dr. Tan's the concern?
Okay, Dr.
Yes,
Qiming.
Dr. Qiming.
Yeah. Thank you, Dr. Tan. Actually, we discussed we like the 1 year or 2 years, but as the least the few years from our training program, we can see the passion from the TCM practitioner. They really take their times and part times to study the traditional Chinese medicine. So even, for example, they come to the clinic, they still have to work. They are not the fully times until they're able to practice the fully time. So in the future, I'm thinking, I really appreciate what Dr. Tan mentioned. So if this competency can be applied in the Philippines already, so more and more practitioners, more and more course there, so they really can be survived by the profession. So I believe that's the time we ask for the 1 year, 2 years, people will be very easier to accept. So we can consider it to shorter. So we just going to find what is the more accessible for the reality here. That's different from the Western medicine. After you are study from graduate school of the school of the medicine, you can go to the hospital already. Here, they just come. They cannot full time, even study no full time, even the internships no full time. Maybe they just take the Saturday, they are the rest day. Maybe they just go with the evening. Maybe they just go with some of the medical mission. So the reality right now, our TCM is a very small group and it's still very first step. So even no standard, no accreditation, even the society, even the practitioners. So that's the first step we want to put it through. Okay, thank you.
Okay,
so we
thank
can
you.
adjust if people, all the group, no problem. We can adjust it also.
Thank you, Dr. Qiming. Dr. Tan, do you have any comments? Further comments?
I think Dr. Cheng is talking about the practical side, which I agree. In our country, many of these TCMs, like there are some medical practitioners, they can only study only 1 or 2 days a week. But maybe in the future, we will be more strict. At the moment, we can set it at 3 years, but I think we should encourage the students to hopefully to finish within a year, while the memory of the didactic knowledge still fresh.
Okay, thank you so much, Dr. Tan. Before we proceed to Miss Janet, let me dive first to the group chat. We have some questions here. Can you please say again your question about the mungkahi sa TCM nutrition, specifically sa herbal? Wala po kasing name si ma'am.
Hello?
Hello,
Naiwan
ma'am.
kasi,
Yes.
naiwan kasi yun kanina, kaduktong yun ng mungkahi ni Janet. So, it's about yun sa TCM kasi di ba, it's very important that we promote yung Chinese materia medica. But with regards to the use of our communities, lalo na yung cultural, yung acceptability at saka availability ng products, can we have, parang mungkahi lang ito and then you don't have to answer, then parang may need na nakikita to include in our skills, yung sa research skills sa TCM competency standards, yung pag-identify ng corresponding Philippine medicinal food for the use of our communities, mga tao, based on TCM framework. So it's more on pag-aaral na kung meron tayong ino-offer na mga Chinese herbs, mga plants, and etc., ano naman yung may offer natin mula sa kultura at saka sa available food and yung mga nutrition na nasa Pilipinas. So using TCM principles and framework. Okay.
Can I add to that? Chinese herbal medicine is very new to the Philippines right now. And for me, there is a need to allow it to flourish in the Philippines. Now, we are in the Philippines, and there are so many herbal plants. No? I don't know if it will take another organization to be organized for it to be able to have a research like yung ginagawa sa China. Because herbal plants natin ang dami-dami, ang daming medicinal properties, and also it includes dietary food. No, and this has not been dealt with properly in Philippine society. No, I hope sana nandito si Dr. Sia, no, because there are many very very good properties of Philippine herbal plants that we can make use of, which I think will be very affordable for the Filipino people right now. No? For all you know, we may be able to discover plants that can help COVID-19 also. Combination of Philippine herbal plants, which is not being done right now. And I'm directing my suggestion and my question to Pitahc, no, for it to be able to do something about this. I have nothing against Chinese herbal medicine, but alam mo, iba ang condition kasi ng Pilipinas eh. No? Ang daming naghihirap. And maramihan to. We really have to work hard so that our own indigenous practices and Philippine herbs can have research on this. Ito yung pwedeng gastusan. No? I don't know how to proceed with this. I am not a researcher, but it can be done. Philippine medicinal plants for the use based on TCM framework. I think may sinimula na dati dyan si Dr. Ed Tigulo, and I think si Dr. Sia can help also in this matter, and those in line with pharmacology based on Philippine herbs. Yun lang ang take ko dito. I think we have
Can I answer in behalf of Pitahc? 63% po ng ating budget for research is on health cluster 3, which means 63% of our budget for research is on safety and efficacy of Philippine herbal plants.
Wow,
so,
nice.
Opo. So, yung mga na-fund na po natin, yung meron tayo po for technology transfer, last year lang po, yung Acapulco, yung Ulasimang Bato as for anti-gout treatment. So, na-present na po natin ito sa mga different industries. So, meron na po tayong takers. So, they will be developing this as a uric usuric drug for anti-gout. And then this year din po, early this year, we presented Tsaang Gubat. Yung Tsaang Gubat naman po, pinondohan natin yon. This will also be used for abdominal colic in pediatric patients. In terms of COVID-19, yung initial po na study on BCO, ginawa po yun ng ating board member, si Dr. Francis Dairit. So, yung initial study po, yung meta-analysis, Pitahc din po ang nag-fund nun. Pero yung RCT, yung clinical trial po, which is being done right now in PGH para po sa ating mga confirmed COVID-19 patients, this is already being funded by PCHRD. Malaki-laki po kasing budget nun. And about yung mga food po, yung tapoy, meron po tayong 10 million grant for tapoy. This will be used, yung tapoy or rice wine, no? This is being done by our two balik scientists from Harvard, UPPGH medical graduates also. This is being studied right now in vitro. After that, there will be in vivo studies as for Alzheimer's. Marami na po tayong mga 63% po, almost majority of our funds are for Philippine herbal plants po. So, marami na po ongoing. Opo.
Okay, thank you. Nice to know.
Hello.
There's another, baka po mapondohan natin yung tawa-tawa. hindi po naging successful yung study on dengue, we will try to study tawa-tawa for COVID-19 kasi meron po tayong hyperprothrombinemia sa ating mga COVID-19 patients at meron din pong ibang presentations like low platelet count. So minsan nagdodoble dengue and COVID-19. So there is a study na gagawin. Titignan natin kung maganda yung kanyang technical proposal. Ipa-fund din po yun ng Pitahc. Thank you.
Thank you po.
Thank you so much, Dr. De Guzman. I think Dr. Qiming needs to answer.
Hello. I would like to answer the Inam and Janet the concerns regarding the local herbal medicine. Okay, this is the competency center for TCM. It is not a curriculum, but in our society meeting, even the first time we see second meeting, which is a Pitahc, we very confident and to mention our traditional Chinese medicine curriculum will include the local herbal medicine. Because I believe during the Fujian University president visit the Pitahc, because of COVID-19, right now travel always affect. Actually, the Fujian University invite the Pitahc to go to China. We are working of the one group. It is the local herbal Chinese medicine, how to work with the traditional medicine series and some research. And last year's 2019, I believe the Dr. Annabelle de Guzman, you still remember from the Guangxi, the herbal garden.
The Guangxi Herbal Garden.
Yeah, they want to develop the local herbal medicine. How is this do the investigation, do some research. So this is the Philippine local herbal medicine. It is the very big of treasure we really need to develop. But if the Chinese medicine develop, I believe they will bring the development of local herbal medicine development here also. So this is the can work together. I'm very sure the traditional medicine here can work together. So this is the why, even we're talking about the TCM, but in our society, we're talking about the curriculum. We always, even right now in the SMIC, the later Dr. Liu can share you, we include the local herbal medicine in the curriculum. So in the Fujian University, our program in Philippines, we are include the local herbal medicine. So we talk to Dr. La also, we get the book, we want to promote the local herbal medicine. This is our, so it means we have the same goal here. Thank you. I just want to add on here. Thank you very much.
There was a product supposedly with the Guangxi Herbal Botanical Gardens in China. They were supposed to come here last March, and they were looking for 300 hectares which they can develop, not for Chinese herbal medicines, but for Filipino traditional herbal products. But COVID-19 came, so they were not able to come. So they have not communicated with us again about the possibility of coming, but we are in constant communication with them.
May I ask a question?
Okay, first of all, thank you so much, Dr. De Guzman. We will be entertaining last two questions because we need to cap off already our public consultation. But it's okay, Ma'am Roxanne Recto, go ahead.
It's a quick one only. I am not a graduate of SMIC, and there are numerous graduates of different schools. INAM, I finished in Ateneo University. So my purpose of my question is, after finishing, I knew I had to be certified or licensed by Pitahc. So I did follow the recommendations of Pitahc, and I got my license to practice. Is the problem with scenarios like us who did not graduate in that particular school, and no offense really, is because are we forever going to be in school? Because yes, it's going to be coming out that way. Are we following the standard that we're following previously? because I'm not sure, I don't have the documentation that you've presented early on, if that's still allowing us people, because we're following that path. So after the certification, after submitting what was required by Pitahc, and we are allowed to practice, and we know we're supposed to wait for the exam and etc., etc. Are you completely going to change the whole system now, or that is my question?
You're a graduate of acupuncture, ma'am?
Yes, ma'am.
Acupuncture, yes. Acupuncture will continue. Tuina massage will continue. Naturopathic medicine will continue. And traditional Chinese medicine will be another one of the modalities. Like some of our practitioners in naturopathy are also acupuncturists. And some acupuncturists also practice naturopathic medicine. We see no conflict in that.
No, I'm not talking about conflict. I'm sorry.
Yes,
I'm talking
ma'am.
about the path, because you're setting up the systems already, right?
Yes.
This is a system set up. So once you put up the system and we're following a path where we're following this previous system, now you're bringing up a new system. Are you changing the system? Is that what I'm understanding here? I'm
No,
asking
ma'am.
for clarity.
Ma'am, may I answer?
Sige, sige. Attorney Chai.
Yes, attorney.
Yan po. Yes, yes ma'am. Yun po yung isa kong i-raise supposedly do sa proposed standards to include in the limitations yung that the competency standards would apply strictly on TCM and would exclude the acupuncture, because we have already established the competency standards and the guidelines for certification and accreditation for TCM, for acupuncture, for Tuina massage, and other modalities. Yun po. So we are not
changing.
Yes po. We are just adding specifically for traditional and Chinese medicine.
Yes.
Just one comment, one last comment. When I did study and I go to Taiwan, we were the trainers there were very encouraged with how the Filipinos were faring against other countries, considering other countries are being supported by their countries with the educational system of TCM in living in Taiwan. So we don't have that. I'm putting it out there now that the reason why Filipinos have attended short modules of classes is because they need to work and they need to earn money. And if they stay out too long to study for 4 years and not go back to whatever they're supposed to do, maybe they're employed, they will lose their job. That's it. Thank you.
Okay, thank you so much, Ms. Roxanne Recto. We're down to the last question, if it's okay to all of you. Do you have any more questions?
Hello.
There's Anisha Silvestre. Solestro.
Hindi natin kasama sa ang Tai Chi at Qigong for now, but hindi siya kasama.
So,
again, ma'am?
Ani?
Tai Chi and Qigong as a modality. Tinatanong ko lang bakit hindi siya kasama.
Yung hindi kasama, Ani?
Yung Qigong daw, Dr. Ras. Qigong.
Qigong.
Bakit hindi kasama ang Qigong at Tai Chi?
Dr. Qiming Sen, there's a question why Qigong and Tai Chi was not included in the course.
Okay.
In the competency standard, I mean.
Okay. Actually, the Qigong and Tai Chi is the major modality of the Chinese medicine. But the competency standard, we're going to provide the minimum. So you can include the curriculum, you can include the different of the qualification or different program. But this is the competency of standard. Try to provide is the minimum of the requirement. Minimum, it means is we are not talking about the curriculum. We're talking about the minimum. So we didn't mention too many things. We just based on the existing program, and then we refer to other countries. So that's the why. But the Qigong and then other Tai Chi, any other exercise is very important. It's a part of the Chinese medicine. It's no doubt. Thank you.
David, just last clarification. David.
Okay, Miss Janet.
Yeah. So I just want to be clear that acupuncture and Tuina will not be subsumed in this particular competency standards because they already have their own competency standards. I just want to be clear on this. And this particular competency standards will be mainly for those who would like to pursue traditional Chinese medicine herbal. No? If they want to go into that, then ito yung kanilang susundan na mga requirements. Is that clear?
Yeah.
Okay. Juris Ryan Fante might want to after Dr. Ras.
I think it's very clear, Miss Janet, that
just want to be very clear about
this standard is for traditional Chinese medicine. So for those acupuncturists and Tuina who finish acupuncture and Tuina, if you want to pursue traditional Chinese medicine, so you according to Sister Liu, you have to pass the examination, then you can take the course for traditional Chinese medicine because it's only SMIC right now who offers the course.
Yes.
Okay, so it's clear
to
everyone. Okay.
One last.
Yes, Ms. Janet.
One last. Since there is Philippine herbal medicine is still flourishing at the moment, and I'm glad to hear what Director Annabelle was saying that it's there is 63% allotted budget. Just a suggestion, why don't we allow Chinese herbal medicine to also flourish and have researches on particular herbal medicine Chinese herbal medicine that's being given to patients and have a documentation of this, and this can be shared in public also, no? If that is the case. Para malaman natin how effective it is also and how effective also is Philippine herbal medicines. How is it being implemented, especially in communities, in very, very poor communities in the Philippines. Yan ang problema naman natin, yan ang madami dito sa ating bansa, actually. Kailangan talaga bigyan ng pansin, especially now, during the COVID-19 period. No? As I said earlier, I have nothing against Chinese medicine, but the affordability, availability, accessibility, yun pa yung problema natin ngayon. So it's a matter of prioritizing. Let it flourish now muna, but we have to also prioritize on our own indigenous Philippine herbs that we can make use also for communities who cannot afford to avail of Chinese medicine. Because I'm sure there will be patented Chinese medicines, there will be combinations, there will be all those herbs, minerals, animals that can be combined, which is really very effective based on my experience. But we're looking into Philippine scenario. Yun lang ang aking gustong i-emphasize. Thank you.
Okay. Dr. Janet, we have just signed the MOA with FDA. So the MOA between Pitahc and FDA says that for all traditional, alternative, and complementary medicines, FDA will still receive the applications, but the ones who will evaluate even the traditional Chinese medicines will be Pitahc. So they are right now training us. We have graduates from their 8-day training, and then they will already put some FDA evaluators with us. Starting next week, they will be giving us little by little the 89 applications for traditional, alternative, and complementary medicine. And together with them, we will sit down, evaluate, and perhaps do some research on these submitted herbal medicines. And then Pitahc will be the ones to recommend to FDA if it's for approval or disapproval or for further studies. But FDA will still be the ones to issue the certificate of registration because we do not have it yet in our mandate. If everyone will support and if God allows us to that the amendments for the RA 8423 will pass Congress, the Senate, bicameral committee, and will be approved by our good president, then in the future we will be the ones to do everything. But right now, I think we still do not have the capacity. Yes, this is the one. Looking forward to FDA Pitahc collaboration. Those are our graduates. So in the future, given quasi-judicial powers, we will be the ones to do everything already. But for now, capacity building muna tayo and training. So we're going in that direction. Thank you for mentioning that.
Thank you, Dr. De Guzman. Any more, Miss Janet? Okay. If we have any more questions, we will be having again another public hearing. Isn't that right, Dr. De Guzman, next week?
Yeah, we can have the public hearing, another public hearing next week, so that on the first or second week of June, we can already put forth to the board the approval or disapproval of these guidelines. After that, we will publish it in the Gazette. And correct me if I'm wrong, Attorney Chai, after 15 days, it will be deemed approved after approval in the Gazette.
Yes, ma'am.
Okay, and after that, the guidelines and competencies will be approved. Then TCM will already be considered officially a modality of Pitahc.
Okay. Thank you so much, Dr. De Guzman, and of course to Dr. Ras, who guided us a while ago during
Yes,
the open
thank you,
forum.
Dr. Ras. He's an acupuncturist, so his inputs are very important also.
Okay, so for the sake of documentation, is it okay for us to take a picture? May I request all of us to turn on our video cameras? Very quick lang po. Okay, will I be the one to lead the counting?
I'm taking pictures, so please give your best smile.
Okay, thank you to our admin.
Thank you.
Okay, thank you so much to Mr. Levi Posadas, our Pitahc admin that organized this online platform for all of us. Okay, so it has been a pleasure being with all of you. Thank you so much to Dr. Qiming Zheng again. Thank you all for actively participating on today's public consultation. Also to the active viewers on Facebook. For further comments or inquiries, you may always message us at our pitahc.standards@gmail.com. Also, try to visit us on our Facebook page at Pitahc Official for you to be notified and be updated on our current projects and activities. Thank you so much and stay safe, everyone.
Thank you.